Support for Carolina Business Review provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries.
Well, we've discussed it before and you've heard it before, but healthcare, and more specifically as it exists now under Obamacare, continues to be one of the single most critical issues in personal and organizational balance sheets. Welcome again to the most widely watched source of Carolina business and public policy, seen each week for the last 25 years in every town in North and South Carolina. Thank you for supporting this program. I am Chris William, and on the heels of the Aetna declaration that major health care payer will cease individual insurance in the Carolinas healthcare exchanges, it highlights again personal and persistent struggles to offer prolific plans under the ACA as it is. This is certainly one concern we will broach on this edition of CBR. And later on, CEO of South Carolina Greenville Health, Mike Riordan, is back.
Major funding also by Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. And by Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com.
On this edition of Carolina Business Review, Cindy Curtis with the Central Midlands Area Agency on Aging, Tim Boyum from Capital Tonight, and special guest Michael C. Riordan, President and CEO of Greenville Health System.
Hello, welcome to our program. Tim, good to have you back. Thanks for being here.
Thanks for having me on. It's good to be here again.
Cindy, we hope this is just not pure pain for you, but thanks for making the trip from Columbia.
Thank you.
Let's start with this whole idea of healthcare. It's starting to bubble up now. A big announcement from Aetna just said that they were pulling out of the Carolinas healthcare exchanges. Tim, United Healthcare in North Carolina announced that they were doing that in the first quarter of the year, or pretty close to the first quarter of the year. So these are two big players in healthcare payers saying, we're not going to play that game around healthcare exchanges. Is this underscoring, is this a big deal for the ACA?
It is a big deal, although it depends on what side you're on. Republicans are saying, I told you so. Obamacare is falling apart. Democrats and supporters of the program say, look, it's just a bump in the road. We knew this was going to happen. We definitely need to make some changes, and it's time to do that. So a lot of it depends on, but in North Carolina, it's Blue Cross Blue Shield. And what does that mean for prices in the future? There's a lot of questions.
Well, you know what? Thank you for bringing that up, because both Blue Crosses in North and South Carolina have already said, this is a very tough environment. We've got to do it. We're committed to the people of North and South Carolina. I mean, that's Cindy in South Carolina.
Right.
But they've all said privately and publicly, I don't know how sustainable this is to offer individual health care at this kind of rate. So my question is, not to go on, is this about politics or is this about policy?
I think in this day and age, it's about both. The bottom line is affected by both politics and policy. In Blue Cross and Blue Shield, I think there's some question about what form they will stay in North Carolina as well. And I asked the insurance commissioner in North Carolina, Wayne Goodwin, that very question if he's nervous about Blue Cross Blue Shield. And he said he's hopeful, but we'll have to see. He said angered by Aetna's decision. He was totally shocked. And, it's hard not to bring politics and policy together on an issue like this.
In South Carolina, the Council on Aging and the AAAs and the aging industry that you are in, Cindy, is this more than a passing concern? And I don't want to minimize it, but is there something to what is going on in the insurance marketplace that would affect the older demographic dramatically?
Certainly, and certainly with our seniors, that open enrollment is coming up again, starting in this October. So you've got a lot of seniors that are going to be trying to struggle and finding new policies to get the right kind of coverage at the right kind of premium. So, this is where, we're going to be probably seeing a large influx of more calls and concerns and really downright, fear of whether or not they're going to have the right kind of coverage. Can they go to their primary doctor? Will their medicines be covered by this policy? So it's going to be quite a task coming up that we see in this open enrollment period.
Do you watch closely whether Blue Cross Blue Shield of South Carolina could do something here? As Tim said, in North Carolina, if the Blue Crosses change their mind about service, this is a seismic decision, isn't it?
Certainly, it will be. We'll be watching it closely too to see what happens and see what kind of coverage they're going to offer for not only our senior population but anybody that needs a a health care policy. So
yeah, okay, all right. Tim, in North Carolina, voter ID was something that was hotly contested in the General Assembly, and it was passed, and it was the law of the land. U.S. Circuit Court struck it down recently, and now Governor McCrory and his administration say they are going to go to the Supreme Court with it. Have they filed yet? What are the odds that they could get a stay of some sort?
They have filed. It's up to Justice Roberts whether he wants to decide whether to put a stay in or have the full court look at it as well. There's been some changes. This was a much larger law. There was issues about early voting, it being shortened in days in North Carolina, as well as same-day registration. There's been a huge outcry about early voting changes and what's happening on the county level, whether they're shortening the days, taking away Sundays. And there's been a huge hoopla just this week about this issue with the state Republican Party and a memo that went out about whether they should stop doing early voting in certain ways to help Republicans. A lot of people believe that will make a difference in how Justice Roberts and the court changes their mind. I think a lot of people believe that the court will let the stay in place and they will not have to deal with voter ID this fall.
Well, how much do you think this hurts Governor McCrory in his gubernatorial race?
That's a $1 million question, right? I mean, there's so many shiny objects out there. We got this little presidential race going on right now. I think they're struggling to get attention on their own. There's HB2 in North Carolina, the transgender bathroom law issue. They're hoping to talk about the economy and teacher pay and things, but there's just so many issues that I'm not so sure that issue by itself will hurt either candidate much.
What's the polling saying between McCrory and Cooper now, given all of this stuff in the mix?
Well, I think most polls look at Cooper with a slim lead. There was an NBC Marist poll recently that had Cooper up 7, but that was just registered voters, not likely voters. So it depends on what you believe in polling this year, too, which is a challenging thing about who's going to go out and vote this fall. But I think if you asked a variety of pollsters, Cooper probably holds a slim lead over Pat McCrory.
Cindy, I don't want you to wade in on politics per se, because that's never fair, but I'm going to ask you anyway. South Carolina, clearly a conservative leaning state. Wouldn't call it a Trump state, but wouldn't call it a Hillary Clinton state. North Carolina, more of a swing state, no doubt about it, and could go either way. Does South Carolina take much notice to much of the hyperbole that goes on during the election year?
Oh, yeah, especially since we're so heavily Republican. So it'd just be real, to me, also a registered Republican, I'd be very curious to see how our state will vote. It has always been strongly Republican. And I just don't see that we've got the candidates that may be quite to the taste of what our South Carolinian registered Republican voter will like. So,
and but beyond the theater of it all, does it really matter, and this is not a fair way to ask it, but I think you'll understand, but does it really matter to the policy of those things that have been put in place in your business?
No, not really. No, because our funding is pretty, it's going to be stabilized. I don't see that it would be impacted. I would hope that there would be more care and consideration for our senior population, since it is growing so rapidly, and that's nationally. So, we really need to put forward more of our funding so that way we can cover our seniors who want to age in place.
And I'm sorry to interrupt you, but just quickly, just to go down that road for one more minute, does the blessed burden of having a growing senior population, does it become a bit of a barrier when funding for transportation and education are already being talked about. Is how are we going to do that?
Well, you have to remember those seniors are registered voters, so I think they can be the ones that can change, how our funding might happen in the future. They need to realize that in order to make a change, they have to get out and vote, and they are very strong. Even with AARP, we'll tell you the senior voters are a very strong, way to swing how a candidate is going to act in the office.
Yeah. Okay.
So,
thank you. Stay with us, guys.
Sure.
Coming up on our program next week, he has grown this bank to be quite the powerhouse, almost $9 billion in total assets now. Robert Hill Jr. is the CEO of South State Bank. I keep wanting to call it South Carolina Bank and Trust. He'll be on this program next week, returning to this program. And then in 2 weeks, he is the North Carolina Budget Director, Andrew Heath, that has his hands full as his budget director predecessor before him did. He will be our guest in more than 2 weeks. Andrew Heath will be joining us very soon. To be sure, everyone seemingly has an opinion or a story or a hospital experience of some sort. That is usually from a patient's point of view, though. There is a change in the air in the way that healthcare providers operate, no pun intended, and it's not for the faint of heart. Again, no pun intended. Upstate South Carolina Greenville Health has just undergone a strategic organizational shift, at least in leadership. With all of the new ideas being tested in healthcare across this country, will this one be the one that proves the best direction for GHS? Joining us again is the CEO of Greenville Health System, new strategic coordinating organization, Michael Riordan. Mike, welcome back to the program. Strategic operating. Why is this? I mean, you all have made a seismic change to the organization at the highest levels. This seems like a real game changer. Am I overplaying that?
Well, I think you just have to remember a governance change is done to support a strategy. And our strategy is how do we create partnerships, how do we grow? And there's really not much new in what we're doing. We're, if you want to just use a term, we're creating an operating company that will allow different units to work together for the transformation of healthcare. Right now, we've created that entity, and the only unit is us. So we sort of have done it to ourselves, but it's a view to how do we create a structure that allows for partnerships not only within the states, but if it happens, even between different states with different healthcare providers.
So I was going to say, does that include just the provider, or are you building in somewhere in the background you're going to bolt in a different type of business?
Well, it could. So I think that's a great question. So we look at, so there's the healthcare provider, but how do we become a health company? You look at technology, you look at all the development that's going on there. We may have non-traditional physicians or hospitals, but non-traditional ways of providing care in a house or to patients that we need to connect with in a better way, because we see our responsibility of taking care of the entire patient throughout a whole continuum of their care.
Mm-hmm. Tim?
It's interesting to talk about that, the whole patient. We hear a lot about that even in North Carolina. And there seems to be an influx of change in healthcare and attempts to change it. But at the end of the day, cost is still the big issue, right?
Right. So, and I think what's going to happen is it's how we get reimbursed that's going to be the big change. So you hear these terms value-based. The analogy I like to use, and I'll do it quickly, is when I bought my first car, I would go over and I would pay for the oil change every 3,000 miles. Now I buy a car, it's covered for the first 100,000. That service center shifted from a revenue center to a cost center just by doing that. Now all of a sudden, I only have to get my oil changed every 7,500. They have to build in better quality. And I think that's what we're being asked by the marketplace, is to take care of the entire cost of it. And we're also being asked, and what we're trying to educate the consumer on, it's not just the cost of the procedure, it's the total cost. You don't save money if somebody has a lower cost, but they do it twice as many times.
How do you ask them to share the cost but not reduce the service and the quality?
Yeah, so I think you have to never ask to not reduce quality. I think you have to have the measurements that actually increase quality and do it more on evidence-based type of protocols so that we're actually doing the things that are needed. You know, how did all of a sudden I not need an oil change every 3,000? That had been a rule of thumb, but maybe not a great practice. So research will really have us looking at what are the most efficacious way of delivering that care, but the quality, that has to be the top the top priority.
Well, how do you infuse more services, those non-traditional services that are necessary when that patient goes home? I mean, you don't want that patient coming back over and over again. Mainly also you get fined by Medicare. So how do you open up that to where you can invite more services and wrap services around that patient when they leave the hospital?
Yeah, this is where I give our board a lot of credit. So our margin will be about 1.5%, not a big margin. We are putting quite a bit of dollars into the prevention side of things. And right now our current system doesn't reimburse us for that. So we now have care managers that are going out into neighborhoods and knocking on doors and saying, last year we identified 61 patients that visited our ER in aggregate 1,000 times totally. Now we're going knock on the door. Mr. Riordan, I noticed you've been in the ER a couple times. Are you taking your medication? Are you doing things? We've got a mobile van. We're putting resources out in the community so that we don't get them to come into us. So, and that's all. Every time we do that, every time we reduce the or do a better job with prenatal care and don't have a NICU baby, we lose money. Right. It's really a crazy system, but we've said we've got to do that to move forward. So that's why our margins aren't a lot higher. What we see is this is R&D on a better way to deliver care, and we're waiting for the payment system and the reward system around that to shift to that value base rather than a fee-for-service payment model.
Michael, you just said something. Let me zoom in on the idea. You said, we want to focus on the prevention of it. I had an attorney at a major hospital system in the Carolinas that you would know, said, I think almost innocuously, in a side conversation we were having, it was a gal, she said, we got this thing all wrong. The Chinese will pay a physician to stay healthy, and they withhold payment when they get sick. That seems like a different motivation, one that actually might work better. Right?
And that is happening here. So if you look at what's happening at a Medicare level, we're being reimbursed based on quality. And if those quality metrics like readmissions aren't going well, money is being withheld. So having systems accountable for outcomes as well as cost, it gets us more fully invested. So I think if I'm understanding her correctly, she may be onto something, and it's something that we're starting to experience in the marketplace.
Yeah. Tim?
The intersection of politics and policy with healthcare, it's impossible for it not to intersect these days. Obviously, you're not going to tell us who you're going to vote for, but what sort of lens do you look at this election through, and how it could impact what you do day to day? Yeah,
so for me, as I look at how do we prepare our organization, a level of stability or consistency. So I do get worried if things are going to be put in and pulled out, because we've got to be able to react to the politics as well as the policy with regards to that. But what I've said organizationally, we've got to show up, not at the effect of what a politician is going to do. We've got to shift the question from who's to blame and why is this happening to what do we do and how do we do it. And that's what I'm trying to get through to our organization. So whatever policy is thrown at us, put me in. We'll figure it out. But I would like to have a little bit of stability or consistency.
Cindy?
As we work through the care transition component, and I know I'm the one with the boots on the ground with seeing our seniors that are coming home from the hospitals, and of course you're seeing them come back. Is there a partnership that could be developed, even with the Area Agency on Aging to help with some of those services? I mean, we know old. We're the ones providing a lot of wraparound services to those seniors so they can stay safely in the home with a hot, nutritious meal, homemaker services, transportation, and also, even with medication management. So where do we see the hospital systems going? Not only your system, but others that you can partner with a regional governmental agency that can help you accomplish your goals and the outcomes that you want to see.
So it's a big yes. So if you look at how we're being reimbursed right now from Medicare, there are these Medicare shared savings programs where we are actually responsible for individual Medicare recipients, and we're responsible for the total cost of their care as well as the quality that comes out of that. And at the end, if we saved money and improved care, we get to benefit from that. We're about a month or two away from knowing how we did this past year, but for the last several years, we have had and participated in a shared savings because we've increased quality and lowered the cost. So that's sort of one. So we also know we can't duplicate everything. We need partnerships with organizations like yours so that we can get out into the communities to improve health. One, it's more at a federal level, but you look at the PACE program, you know, as you look at care for the elderly, we're given a set amount to manage the care for an individual participant. And we're responsible for that. We're responsible for improving the quality and reducing the cost. So I think that's just how we're going to be reimbursed more and more, and we've got to do a better job of managing and reducing waste, which is something you hear in manufacturing business all the time. Right. Reduce waste, improve quality, and then lower the cost.
Recent announcement, Michael, had Aetna, the third largest healthcare insurance in the United States, pulling out of the healthcare exchanges in the Carolinas. Second quarter of this year, we saw United Healthcare do the same thing. We've heard the Blue Crosses in North and South Carolina saying it's very unsustainable model that we have in premiums and trying to deliver healthcare in the Carolinas. You know, after a while, you have to look at all of these insurers together and say, maybe it's not about politics. Maybe there is something on a policy level that's not working with the Affordable Care Act. Right. Is this a pretty big stake in the ground to say we're going to have either reform or replacement at some point?
I think it's a pretty big stake to say there's still a lot of flux in the marketplace. And so my experience, there is so much money involved. These are national players. We're going to find individual insurers coming into states. The marketplace will figure this out, but I think it's going to be a rocky year. And if an organization like Blue Cross of any state exploits this now, I think they'll put themselves at a competitive disadvantage. So why do I say that? If we look at how the world is changing, we see even organizations like ourselves are using language that we never used before. How do we become risk capable? How do we manage and become at risk for the wellness, where if we do a good job, we get a reward. If we don't, we take the negative benefit of that. That sounds a lot like an insurance company. What we're seeing now is you see providers that are talking about acting more like insurance companies. You have insurance companies that are buying hospitals and buying physician offices. You have businesses now that are creating clinics on their sites. So we're seeing a mishmash of traditional business lines moving into the other side to solve this. So that's why I think somebody's going to move into that space. So you'll either see providers creating their own insurance products or partnering with insurance companies to create products, or you'll see insurance companies buying providers to provide this. But there's just too much money that somebody will fill that void. With annual, how people get enrolled, it could be a difficult year. I'll speculate on that.
But let me ask you, but these large companies are saying, yes, but it's the market will work the way the market works.
Yes.
But are the rules enabling a better marketplace? So I come back to the idea that is the Affordable Care Act optimized to the way it should be?
It sounds like from their perspective,
it's
no.
not?
But if you look at nationally, you'd have to look at the whole balance. You know, there are still lots of marketplaces. And what was it there to design to do, to provide insurance? There's still a lot of people that have got coverage. It goes back to what side do you want to argue, but I do think it does need to be and will be tweaked, and I think the marketplace will help that happen.
We have about a minute left. Do you have a quick follow-up?
Yeah.
Consolidation,
yes.
Is it inevitable to continue, and what is the impact on price and quality?
Yeah, I think consolidation is inevitable, especially if you look at us being held more and more responsible for taking care of larger populations. Gone are the days when, even at a business level, that the employee wakes up and can walk across the street to where they work. They're spread out through an entire region. There has to be a delivery system that can cover that region. I think the way you mitigate prices going up is how you pay. It's just like in construction, guaranteed max. You go over, you're at risk, you're under, you share in it. And I think we're seeing that those payment models slowly shift at a federal level, and I think you'll see them happen at a state level, and with the businesses as well. There'll be probably more direct negotiations with businesses.
Michael, thanks for being back on the program. You look good. You seem to be doing a great job in the upstate, so keep it up.
Will do. Thank you.
Yeah, good to see you.
Yes, sir.
Cindy, welcome to the program.
Thank you. It was a
Tim,
pleasure being
love
here.
the bow tie.
Thank you, sir.
Always
Appreciate it. Always.
Looks good.
Thank you, sir.
Until next week, I'm Chris William. Hope your weekend is good. Good night.
Major funding for Carolina Business Review was provided by the Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. Grant Thornton, operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Novant Health, bringing you world-class technology, clinicians, and care, when and where you need it. Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.org.